All right. Hi, Adam. Thanks very much for joining us today. You've agreed to come on board and tell us a little bit around yourself, your journey of recovery, and some little nuggets of wisdom that you can impart to anyone who's listening to this. So, can you tell us a little bit about yourself, a little bit about your case history? Bring us up to speed. Tell us what's been going on.
Yeah, so I first started having CPPS symptoms when I was in my 20s. And it was around a time when, I was going through some things in my personal life. It was fairly early on in my career. So, lots of sort of work-related stress and not always dealing with that in the best way. And I guess I started to notice symptoms, went to see a doctor at that time. And there was a trace of an infection from a urine sample, although it wasn't particularly conclusive, but they prescribed a short course of antibiotics. That was all fine. Then the symptoms reoccurred, and I sort of lived with them for a period of 6 months to a year when I was in my 20s. And it came to a point where, they sort of got to, a level where I wanted to do something about it, and went to see a urologist, regular meetings with my GP. They prescribed another course of antibiotics, slightly longer periods, 4 weeks this time, and symptoms went away, and actually didn't really come back for 10-12 years. So I had quite a long period of not really having any symptoms at all, and I thought, well, it's just a minor thing, didn't really give it much more thought. And then early in 2021, I started getting the symptoms again, and then sort of took me back to where I was when I was in my 20s, obviously in my late 30s now, so slightly different place in my life. In terms of the symptoms, how they are for me, I've never really got sort of extreme pain. It's tended to be, I would describe it as a dull aching in my pelvic area. So in the perineum, lower back, buttocks, my rectum, the base of my bladder. And it's just sort of quite unpleasant and just tends to grind you down. So that's how it manifested for me. I also had some quite strange symptoms, like just a general sensitivity in my pelvic region, which sometimes made walking difficult. And it was quite strange. But yeah, when something as simple as walking is not necessarily that easy, then and particularly for me, who's quite an active person, then that it's a bit of a problem. So anyway, went through the whole process of, I'd had these symptoms before, so and I'd had the diagnosis of chronic prostatitis when I was in my 20s, so I knew what it was. I went back to see a GP, and sort of went down the urologist route, ultrasounds, flexible cystoscopies, not particularly pleasant, and got to a point where we'd ruled out that there wasn't necessarily anything wrong seriously from a medical point of view, and then you're left with this chronic prostatitis or CPPS diagnosis, and really not much more support as far as the healthcare profession is concerned. So yeah, I was then very much left in this no man's land of working out what I do and how I take this forward, and how I try and tackle this condition and the symptoms that we're presenting.
That's fabulous. Thank you very much, Adam. And not only, excuse me, is there pain and discomfort, but you also mentioned there about how much else that can influence us as well. So not only are we experiencing something that's vastly unpleasant as well, but the knock-on effect that can have over to something that we often take for granted. You mentioned walking in your particular case.
Yeah, exactly. Yeah, and all of the things that I think this has been talked about a lot, I'm sure, in the recovery room, but all of the things that you're told by the healthcare professionals, which are, you can't drink caffeine, you can't cycle. I'm a keen cyclist. You can't ejaculate, or you should ejaculate late. They're not particularly conclusive. But when you're sort of given that advice, I mean, your life shrinks because of the symptoms, but then your life shrinks even further because of that advice. And you're then sort of having to navigate your way around all of these things. And in my case, it resulted in some quite sort of significant health anxiety. And that then has also a knock-on effect on your day-to-day living, really. So yeah, it's a tough one to navigate your way through.
Yeah, totally. I mean, uncertainty it almost kind of feeds uncertainty then as well, doesn't it? What do I do? What can I do? What should I do? Is this what's causing it? Maybe I should cut this out as well. Maybe I walked down the stairs the wrong way, or maybe I got out of bed, or maybe these trousers or those socks or that program or that bowl of cornflakes, or it can really, really become very, very much, I don't quite know what to do.
I think that the test that I tried to apply when all of those thoughts were going through my head was, I was doing this for years before I started getting these symptoms. So I was eating this food for years before I was getting these symptoms. And, I'm generally quite sensible in what I eat anyway. I have 1 or 2 cups of coffee a day. I was doing that for years before I had these symptoms. So why should the situation be different now? If I go out and have a drink, I've been doing that for years before I got these symptoms. So why am I now starting to worry about all of this stuff? There's something else that's going on here that's causing the symptoms. For me, that's I suppose the position that I got to.
And I think it's a good anchoring point as well, isn't it? Add some common sense, if you like, into the equation, which can sometimes go amiss when we don't know what to believe, and when we look online and that becomes our resource for information, it can become very confusing. So you mentioned there a question that you had posed to yourself, a way of kind of bringing back a reality check. Were there other components? Were there maybe 3 things that you might be able to identify as being also alongside this as integral components of your recovery?
Yeah, I suppose I'll try. There's lots of different bits. I tried to group them together into 3 areas. I think the first for me is physical activity. So for me, that was hugely important, just to hugely important for your physical and mental well-being, but also to get you away from the idea that you're not well. Actually getting back to physical activity is quite important. And doing what you can. It took me a while to get back on my bike, but I got back on my bike, and until I was able to get back on my bike, I was swimming regularly, doing yoga, and I think you just you build it back up. But physical activity has always been important in my recovery, and I think also something that you helped me understand as well was that some of the physical activity that I was doing was focusing in on my pelvic area. So I was using yoga to do particular sort of pelvic floor relaxation exercises, for example, when actually that just brings the attention back to your pelvis, and it brings the emphasis back onto your pelvic area, and moving away from that and just doing more general exercise, viewing it as something that I did before and that I've always enjoyed doing, and something that is of benefit generally to me as an individual, not just because I have these symptoms was definitely a step forwards. And you know, for me, the physical activities that I've talked about were things that I've enjoyed doing beforehand. So it also meant a return to meaningful activities and just getting back to normal. So yeah, physical activity definitely one of the three. The next one I've put down is cognitive behavioral therapy. So for me, there's definitely a psychological component to this condition, as I suppose there is with any health condition. But I felt particularly with this condition, there's definitely a psychological angle. And for me, realizing that my experience of the symptoms were really about how I was responding to stressors, how I was responding to physical sensations in my body, was quite groundbreaking, because it meant that I could do something about it. And I viewed this as something that I could manage and control rather than something that was just happening to me. So I think that was quite empowering. But also, as I said before, I had developed quite a lot of health anxiety, and my thinking had become quite distorted, and my sort of life had been impacted by the levels of anxiety that I was experiencing. So I wanted to do something about the anxiety, because I recognized that that was, you know, an issue that I needed to work through. And the CBT, it just gave me a number of tools that I could use that would allow me to really check in with what was going on with me at a particular time. And I was actually amazed at how you can do some quite simple things to improve the way that you think and feel about things. And I think that those are tools that I will use the rest of my life. I've definitely learned a lot from doing that therapy, and yeah, would definitely encourage people to sort of to look at that. The course that I did was online, and I got that through my employee assistance program at work, but I think it is available through the NHS as well. It's called Silver Cloud, so yeah, I would definitely recommend that. The third one is, it's a bit of a catch-all, but I've got mindfulness, breathing techniques, and meditation. Mm-hmm. So Carl, with your help, I identified that I needed to take the focus off the pelvic region generally. You know, I wanted to be aware of what was happening in that area of my body, but not more than any other area. And so you suggested a number of mindfulness exercises, a number of breathing exercises that I could do, just to rebalance things a bit more. And you know, these were all things that were really, really simple, and could be integrated into day-to-day life. So and again, are probably things that I'll keep up, you know, for the rest of my life, really, just ways of dealing with stress. You know, if I'm experiencing particular things in my body, then I'll probably use a lot of these things in future. So that was definitely really important. And also getting into meditation. So I've been interested in meditation and actually wanted to get into it for a while. I read a couple of books before I got these symptoms about it. But yeah, I have got into meditation as a result of having these symptoms. And for me, particularly Vipassana meditation, it helps because it teaches you to focus in on different physical sensations in your body. But really, I suppose, put very, very simply, to view them with indifference. So not to become too emotionally invested in any particular physical sensation. And that, it taught me to take the focus off symptoms in my pelvis and B, it also helped with my response to any symptoms. So just how I would respond if I had a particular symptom. And, I still have sensations in my pelvis now. They haven't gone away, but my response to them is very, very different. And I think that's definitely been a huge contributing factor. And I think I will meditate for the rest of my life, just because I find it so, it just brings me a lot of peace, and it definitely relaxes me. And it brings you back into the present, which, when you're really stressed out with stuff, is hugely beneficial. So yeah, those are the three. And I think I've touched on this before, but I think a combination of those things really has got me to a place where I'm viewing any sort of residual symptoms or physical sensations that I experience as being just that periodic sensations, not something to be emotionally invested in, not something to respond to significantly to. And yeah, that's where I am.
That's lovely. What a what a great insight into what's been helping for you as well. And thank you for your openness and honesty. Mental health, anxiety, worries, concerns. We are born of our mind, and the world that we live in is also part of that as well. So we can't dismiss the mind as being not integral here. But to say that your thoughts or your feelings, your work, your pain is in your head, that's a very different statement. But being aware of the connections, my head isn't in a formaldehyde jar, my brain isn't something I can physically, tangibly take out and see. It is integral to me as well. And I guess reflecting on what you were saying here, Adam, even when you're being more physically active, that's going to help you mentally. If you are doing an activity and maybe you're getting a sensation in your pelvis, then you can extinguish that and manage that through doing some CBT type approaches. And mindfulness almost encompasses much of this as well. Even simply being aware, sitting here at the moment, I can let my shoulders relax a little bit more. I can take a slightly deeper breath. I can feel sensations in my pelvis that are normal. I can feel the chair pressing up against my sit bones and my sit bones pressing down against the chair. I can feel my trousers, but they're normal sensations. And when you're in this place of recovery, then things like that normalize, and you're able to kind of have much more of a neutral response to sensations that bubble back up again. So kudos to you. It is a journey. And as you said, that you've learned an awful lot of tools and techniques that you'll just use in your day-to-day life because, well, one, you enjoy them, you find benefits in them, but they can help us to navigate. I mean, goodness me, we're January 2022. It has been insert your own word here, past 22 months. So yeah, using those techniques just out there in the big wide world will be incredibly helpful.
Yeah, indeed.
If you could throw back time, if you could wind back to, let's say when your symptoms began again, perhaps more recently, as opposed to in your early 20s, but if there is a message for your early 20 self as well, then what would you say to yourself if you could wind back time and give yourself a little whispering in your ear?
Yeah, I think probably two things. One would be prioritize your self-care. Because I don't think I've always done that very well, and I think at certain points in my life I've suffered as a result. So that would definitely be one of them. I think the other one would probably be mindful of the limitations of the biomedical treatment model. And I suppose don't necessarily believe everything that you get told by doctors and urologists and other healthcare professionals, and be open to other forms of treatment, which for me, have been hugely beneficial. So I think, yeah, those would probably be the 2 points.
Yeah, wise words. And thank you very much, Adam. The biomedical model is there for a reason. It can work very well in certain circumstances and situations. And there are certainly, excuse me, people that do recover if it is a bacterial infection through partly the use of antibiotics, but also other aspects of just generally looking after ourselves.
Yeah.
Can I pull you up on something you said? I just want you to expand on that a little bit more, if that's okay. So you said not to neglect your own self-care.
Yeah.
What does that mean for you, Adam?
I think it's being aware that you need to have self-care. That's the first thing, because sometimes you're not always aware of that. And I can think of particular times in my life where I put work first, for example, when I possibly above my own well-being, or and it's interesting that in some of the therapy that I did, they used the analogy of the oxygen mask in an airplane. You can't actually help other people unless you help yourself first. So I think that's something I've not always been very good at doing, and recognizing that I need to do. So yeah.
Yeah, me too.
Yeah.
Yeah, so yeah, absolutely. Making time and space for yourself, and not prioritizing other things, because ultimately you can't work as well as you want to, or are required to, if you're not looking after yourself, can you? As one of the examples you gave there.
Yeah.
Fantastic. So that already you've got lots of wonderful, lovely messaging here for those people that are in the throes of their pelvic pain and very much in their journey. Is there anything additionally, or maybe in summary, that you'd like to impart to those that are still struggling and are in recovery?
Yeah, I mean, I think probably the main point would be patient and don't give up the faith, because I know certainly from my own experience, things don't necessarily happen quickly in terms of recovery, and it takes a lot of effort and thinking and trying different approaches to find out what works for you. But I think that the body has an amazing capacity to heal, and definitely keep the faith that you can get beyond this, and that you can find your own way of getting beyond this.
Wise words. And there are times when our faith is definitely challenged, isn't there? I don't mean from a religious point of view, but from our hope and what is the point, and do I even bother? So yeah, absolutely. Yeah, try and see the bigger picture. Again, really, really wise words, Adam. Thank you so much for your insight. Thank you once again for sharing your story and being generous enough to give your time in helping others who are going through this process at the moment. Always a pleasure to catch up. Thank you very much.
Okay, thanks, Carl.